Hello and thank you for clicking on this video. This is an information video about dental implants. My name's Ali. I'm an implants dentist at the Regency House Dental Clinic in St Albans, and I have practiced also for the last 20 years in London's West End and in Harley Street. So the video is for serious lookers, people who are serious about implants, and for our patients who need more in-depth information. It's not an advertisement, it's not an ad, it is proper information. Everybody's individual requirements are different, so this is also still quite generic, just to get an understanding of what an implant is. And there's our details there at the bottom in case you'd like to contact us for more information. So in simple terms, the implants are those big metal screws that are inside the bone there. So they replace these natural teeth. So that's the before, where two teeth had snapped off and we couldn't make a bridge for those teeth because there wasn't enough tooth remaining beyond the gum level. So the teeth were removed, implants were placed. After a short healing period, usually 6 to 8 weeks, we created a bridge. So this is an X-ray. Obviously it doesn't show the beauty of the treatment. However, this is technically what it is, and the bridge is screwed down into the implants. You can see these tunnels here in the implants. On the right hand side here, the right central incisor tooth is a dental implant, which I'm very proud of, and you can compare it to a natural tooth with a crown on it. Sure, this crown can be improved and can be replaced, but that's basically what it is. However, for the very discerning lookers, you will notice that there's a slight bump here, and that bump is a natural bump caused by the shape of the root of the tooth, whereas with dental implants, that's very difficult to achieve and usually unnecessary, but some people want it to look as natural as possible, and to do that we'd have to do specialist gum grafting to improve that. That's a broken crown, by the way, that's not an implant. So the real implant is this, and it looks very natural and healthy. More explanation of what an implant is. So that's a titanium screw directly connected to bone, and this is a tooth which has living tissue inside it. It's got living tissue outside of it, and the living tissue connects it to the bone. So this tooth moves by about that much, which is a little bit, it's only 0.2 millimeters. Implants don't. So when we fit them, we always make them a tiny bit shorter than the natural tooth surrounding them. Moreover, implants are actually more susceptible to gum disease if they're not treated well. That's an important thing to note, that implants are not magic. So what do implants do? Obviously, they replace loose items like dentures. This is a full denture, this is a partial denture. Obviously, our teeth are very important. If this person's tooth were there, then there would be no reason to see something odd. But the odd thing here is obviously the missing tooth. So implants improve people's quality of life. They help to preserve the jawbone, and they give better chewing, and so on. And again, if before we had dental implants, bridges were common. And a bridge involved shaving the tooth in front of the space and shaving the tooth behind the space, so that you could make a three-unit apparatus that would be glued to these teeth. And obviously, flossing is a problem, etc., etc. That doesn't mean to say that bridges aren't good. We still do make bridges when it is necessary. So, or when it is better for the patient. So sometimes implants, sorry, you can't have an implant, but we could make you a bridge here, and that becomes a better option. However, given the choice, most people nowadays would rather have a single item. Admittedly, it does involve surgery and all that, and we'll get to that in a minute, but people would rather have that than have to shave their other natural teeth. Again, this is a gentleman with a gap. That's the dental implant, and that's what the smile looks like, instantly transforming the smile. Do implants have complications? Of course they do. So the bits that go on implants, for example, if you have an implant with a bridge on it, that's what it could look like if it's not well looked after, or if it's made badly by the laboratory. Can implants fail? This is a failed implant. Not one of mine, incidentally, but it is a failed implant, and it's one that came out with the tooth, and implants can get infections and fail. If the implant's not done correctly, that purple dot there, is the nerve of the lower jaw, and this was an implant done back in the old days, and everybody thought you had to put in a really long implant to get better stability. Now we know that's not necessary. So the surgeon here inadvertently pinches the nerve, and that's led to some numbness in the lip. So they've got to be done by the right people, they've got to be done with 3D X-ray guiding them, and they've got to be done carefully with modern techniques. How long do implants last? Everybody would like to know, everybody asks that question, and of course there is no lifetime guarantee. So how do you know that if you have your implant in the 20s it's going to last you through to your 70s? We can't say that for sure, we're not allowed to say that for sure. What we're allowed to say is that your implant, if done well and looked after, should last you a good 20 years. Is there a solution if an implant fails? Of course there is. So if an implant comes out of the jawbone and it's left to heal, you can start again. So it is possible. A lot of patients ask the question, should I have my tooth out and have an implant? Well, this is a discussion we have with patients every day, and we discuss whether their teeth are good enough to build on, and if we do so, could they have a root canal and a crown, and would it serve them? Or is it better for them and more cost effective and more logical for them to remove the tooth and replace it with a dental implant? So this is a bit of research for those who are very bored in watching this, and basically what it says is that there's no lifetime guarantee for either a natural tooth or an implant, and we have to make decisions for the long-term health and benefit of our patients. A lot of patients ask, does it hurt? So the truth is that, of course, when we do injections, the injections sting a bit. Should the implant procedure hurt? Absolutely not, but sometimes the anesthetic starts to wear off, so we just top it up. But the actual procedure itself is as close to zero as possible. Even though patients may be aware of something happening, they don't know even when the implant's gone in. There's drilling, there's incising of the gum. We have to cut the gum open often. So there is surgery. However, it's 99.999% painless. Afterwards, we can get some swelling, we can get a little bit of pain. Sometimes we ask patients to use ice packs to make sure that their chins don't swell. For those really anxious, nervous patients, you can provide sedation, either with a tablet taken by mouth or intravenous in the arm. So this is a bit of a funny one, because we laugh sometimes when we tell patients that they're going to have a bit of cow bone in them, and that's actually what a material like this is. So these are basically the bones of animals. They can be cows, they can be pigs, they can be horses even, and they're specially reared, and then they get the bones and they boil everything out of them. There's no protein, there's no cells. All this is the calcium from that bone. And when it's placed into the area that we want to build out, say for example we've placed our implant but we need to build out an area, this acts as a scaffold for the body's bone cells to build new bone around it. Sometimes some of these materials will stay, sometimes they dissolve away. There's a whole range of materials. There are also human-derived materials and there are synthetic materials, and sometimes we don't need to use them at all. A lot of patients ask, do I have to wear a denture? And the answer is sometimes, sadly, yes. Sometimes we need something that will support the patient's ability to eat or to look good whilst the area is healing, and there is no alternative. There's nothing that we can fix to the teeth either side. For example, maybe they have crowns on them or they're weak teeth and we don't want to jeopardize them. So we use a loose item like this, a loose device like this. Most people hate them, but they do get used to them, and they're just for a few weeks or at the most a few months. There are other solutions, but expensive, so sometimes it's possible to actually place the implant and to make an immediate tooth to attach to it. and sometimes it isn't. Sometimes we can put temporary implants in, which obviously costs more money, but they can help people to have something fixed, and then those temporary implants can be removed after the main implant is healed. But that's a very roundabout way for a very simple solution. So as I was explaining, this is immediate implant placement and restoration. So if you want to skip this bit, this is basically a tooth was removed. This is a drill in its place, checking the position and the angle, and then that is the implant inserted with a temporary tooth attached to it. So that can be done. However, we are very, very picky about who we do these for and when we do them, and we prefer not to, because that raises the risk of failure. If you've got an implant nicely buried in the bone, healing away, that's nice and safe. You can chew on that side. After a couple of days, you can chew on that side, no problem. You're not going to harm the implant or disturb it. However, if you've got a tooth attached to it, well, there's a risk there where the tooth may be jiggled, and if it's jiggled while the implant is trying to heal, that can cause failure of the implant. There you are. There's a tooth that had to be taken out. That was the implant put in with the bit attached to it, and there's another temporary tooth. And this is a real life patient, drinks a lot of coffee, but this is the temporary tooth, which looks pretty much amazing. So after that, it was replaced with a natural tooth. There is the final, not a natural tooth, this is the final crown that was attached to the implant. So patients sometimes ask, well, I've been told I don't have enough bone for implants, and the not new, but the researched way to replace teeth when there is not a lot of bone is to tilt them. And many of you will have seen pictures like this where the implants are put in sort of sideways or at an angle, and it's been discovered that it can be done. So in the old days, we used to think that implants had to be placed absolutely dead on straight because of the forces, of the biting forces and chewing forces, but it was later researched and discovered that no, you can put implants in at an angle, and then they have these attachments here called abutments, which change the angle so that they can then straighten everything up for you. Another option for implants, for patients who are interested, is implant-supported dentures. So instead of a fixed set of teeth attached to implants, we have implants with little buttons or clips on them. And then the denture has attachments inside that clip onto those clips. Here again, 4 implants with a bar connecting them, and then inside the denture are clips that clip onto the bar. And this can be, the advantages of this are that it's cheaper, you can use fewer implants, and it's easy to clean, which is a very, very important part of any dental implant treatment. Again, this is to demonstrate the tilted implant here that is designed to help support this back area. So you can see these are a patient's old implants put in nice and straight, whereas this is one that I put in tilted so I could support this area. Teeth in a day. A lot of patients want to have teeth in a day, and this is a common situation. We do it very frequently. So that's a patient's denture, not happy with it because it's loose. These are the implants in the jawbone, some at an angle, some nice and straight. And then this is the connecting bar that connects the teeth. That bar wasn't made that very same day. That bar was made later. However, on that day of surgery, the patient had a fixed set of teeth attached to those implants, which I'll show in a minute. Just wanted to touch on the fact that we always plan everything digitally. Digitally in the sense that we can see in 3 dimensions where everything is, and we can also plot implants on our digital scans. And we can also make guides that guide our implant placement. So that's me in the reflection there, and that's sort of our 3D imaging systems so that we can plan our implant placements. That's us again in surgery. So we tend to set the surgery up in the traditional protocol, almost like an operating theatre. Everything's sterile, everything's clean. Obviously, that's actually a modern, a recent one with I'm wearing an FFP3 COVID-19 safe mask, So that's just to demonstrate to everybody that we do our utmost to protect them, prevent any infection or cross-contamination. And an implant is a medical device being inserted into the jawbone. So it's essential to ensure that when you're doing this under the cleanest conditions possible. We cannot claim that we are hospital-grade sterile, but we can certainly be very, very, very clean. We call it aseptic technique. Going back to that case, this was the temporary denture being made on the day, or the temporary denture being converted to a bridge, and that's when it was fitted. So that was the temporary case. That's what those abutments look like when they're sticking out of the gum. So there are implants inside the jawbone. There are these bits attached to the implants called abutments, and then the implant bridge screws down onto these through these screw holes here. Another option is metal and porcelain. So there are different designs and different materials used for dental implants. This is an old one where we use porcelain and metal, and actually we had to change this because these little sticky out bits were preventing the patient from cleaning properly, which was beginning to cause infection. So we had to shave all that away at a later stage. Nowadays we design our bridges a lot better, and we ensure that patients can clean really well. See here, a brush is being used to clean below the bridge, between the bridge and the gum. Right, so that's an indication that ideally, if you're having dental implants, you should seek an experienced, well-qualified practitioner. Word of mouth is very, very important. Consultation with the dentist is very important. Ask them to show you cases they've done. There's nothing wrong with that at all, and try to avoid, in my opinion, try to avoid dentists or dental surgeons or dental practices that might be doing it at incredibly low prices. So the conclusion is that implants are a great replacement for missing teeth in the right person. Sometimes bone is needed, and yes, there is surgery, there's a little bit of pain, a little bit of swelling, but the general outcome is amazing. You can have things like teeth in a day in the right situations. However, very important to point out that even as an implants practice, an implants person, functioning natural teeth are always better than implants. So we hands down say this: if we can get your natural teeth to work better and last you for another 5 to 10 years, we will often recommend that option. And then if that fails in 5 or 10 years time, you're very welcome to come and have an implant. However, we'd rather buy you time with your natural tissues rather than immediately replace your teeth. And another important thing is that implants aren't magic. So they can fail. They can have problems like loosening or infections or bits chipping off of the teeth that we have to fix. And long-term maintenance and care are essential. So we have to teach you how to clean around your implants. We have to monitor that. We have to see you after you've had your implants at least once or twice a year. If you're not one of our regular patients, we still ask you to pop in at least once a year. And we look after you and your implants. So there you go. I hope you've enjoyed this video. I'm sorry if it's been very, very long. And thanks for watching. There are our details. Please feel free to video, but I'll attach these videos also as links below the video. Thanks for watching.